The following is a Productions original series.
Hello and welcome to Walk and Roll Live. I'm Doug Vincent, along with Addie Rich. Our podcast is dedicated to amplifying the voices of the disability community. I am a polio survivor, and Addie
has cerebral palsy.
Yes, you do. So, how was your week? How's everything in Atlanta, Georgia?
It was hot.
Yeah.
Very hot.
Getting real.
Mid-90s every day.
Ooh.
Which isn't horrible, but the humidity is what makes it horrible, right? Yeah. So it's a combo platter that actually makes it pretty unbearable. And I feel like we went from temperate, oh my God. Yeah. So it's fine. I mean, I'm more than, I know where I live. I'm not complaining.
Right. Yeah. No surprise. Right. Yeah.
It's just here. It's here and it feels early because it kind of lasts, but I don't know.
Do you,
I like getting outside.
Sorry. Yeah. Oh yeah, definitely. Have you seen any of the reaction when you got the World Cup going on, the FIFA World Cup, and all the people from around the world that are going here, and it's going viral with
Yes, just because people aren't used to it. But also, It's funny. It's one of those things of being a host city. It's great for the city to bring in income and do all these things and stuff. But literally, if you read different things where people are there's games, don't go out of your house. You know what I mean? Don't go to Midtown. Don't go to don't go near the stadium. I feel for all the people that live in the surrounding neighborhoods of the stadiums because people are getting drunk and just being crazy and they're not from here, so they don't care. And,
it's soccer. It's not new. They've been doing this for years. Where
1,000,000%. Yeah. I think that it's just the people who decide that they're going to be a host city aren't typically the people that live in the area that are then hosting. And so I feel like some of the
you mean coming to take part in it? You mean the spectators?
But I'm also saying people that set it up don't live in that neighborhood. So maybe the infrastructure that they're setting up around it to prepare for the large crowds is not ideal. Yeah. Because
never thought of that. And interesting. But the thing I like about all these things that have gone viral is, and it's common in no matter where they're from, Australia or Italy or the UK has been a big one. I've seen a lot of people from there. It's just that they were really reluctant to come because they've grown up on a steady diet on their news. These aren't my words. These are theirs. America is this horrible place. It's dangerous. It's just terrible. And they come here and they're just wow, the things like having air conditioning, they have no air conditioning. People are just, they're melting down. And, somebody will ask them, well, so what's a hot day in England? 86. Yeah. It's what do you mean?
Yeah. I mean, there is a lot more.
Yeah.
Yeah, I feel like they have to almost have more EMS and medical staff and things on duty for people that don't know what
and more ranch dressing. And they have to have plenty of ranch dressing. They love that.
I know. I mean, they're one of the people I love to listen to, of course, because I want to tell you their name on Insta, but it's a husband and wife team.
Mm-hmm. Oh, yeah.
And they always chit-chat about stuff. You know the one that has the ranch baby? The nickname
I haven't watched enough to know that. Baby. Is that the Squiggy or Squishy or?
Mompatour chat? Whatever. But their little one, they call her Ranch Baby because she's obsessed with ranch.
The ranch dressing, yeah.
And so because they're not going to reveal their kids' names, right? So they're always and Ranch Baby, and it makes me think of that, Ranch Baby.
I had a friend of mine, she was into ranch dressing, and I mean, we sit down to have whatever it was to eat, wasn't tied to anything in particular, but, can you bring me a soup bowl full of, and they look at her, but they would oblige her all the time.
Right,
exactly. Good times.
It's would you like some salad with your dressing?
Yeah. I'm going to eat my salad with a spoon. Man. So I went to the Angel City games over the weekend, their annual big game, and 20 different adaptive sports. Tried pickleball for the first time.
Okay.
And that was humiliating and interesting and fun all at the same time.
It seems very weird. It seems like it would be a hard game to play.
Well, because you're in a chair, and how do you move around? And Well, Well, they give you an extra bounce.
Okay.
Yeah, so the ball can bounce 2 times before you get to it. I didn't even get that far yet. I started by learning how to serve. That's what really I could not quite get
Your
it.
poor shoulders.
Yeah.
Either.
Well, yeah, that's one of the reasons why I wanted to try to kind of see what it was going to be like afterwards. So, and then I played some bocce ball. But I'm sorry, go back to the pickleball. Then I moved over to where the gal was. We were just, she wasn't trying to beat me. We were just getting that feel for lobbing them back and forth, and that was much better. That I got much better. So I feel at some point, I'd like to get into an actual game and play it. Yeah, and the shoulder, was a little aggravated, but not too bad. Not too bad.
Yeah. So a funny thing that my friend and I went to, which I didn't even know was a thing, yesterday, we went to indoor wiffle ball. It's called like Major League Wiffle Ball.
With like a bat, like a baseball game with the wiffle ball.
Yes, you know how like when you're a kid, you get the plastic bat and the little wiffle ball? This is apparently it's a thing, and it was being broadcast on ESPN.
Yeah.
I was
amazing, isn't it? The pitching especially, because that ball moves around so much, right?
Yes, and the fact that like they had one of the speed counter things, and it's like 105. I'm like, who's throwing a wiffle ball at 105? But that pitcher dude was like into it.
And that's exactly why they have a wiffle ball, because all those holes in it, it slows it down. So it slowed down. It's 105. Wow.
Yeah, it was unique and entertaining. And obviously, like a lot of places we go, they did not have handicap seating. So we ended up in actually a really good seat because they're like, where can we put you? I was like, well, that's the trick. You buy the cheapest seat, then they put you in a nice seat.
Right. Don't tell your secret.
Exactly, right? We were laughing.
Is this an old stadium?
No, so there's a movie studio in Atlanta, well, like Northeast Atlanta, and it was one of the sound stages. They had built a wiffle ball stadium and then like erected like bleachers and all this.
For this event.
Yeah.
Gotcha. I didn't see how they worked. A little tangent here, but in where we were playing pickleball, and shout out to El Camino College, that's where it was. And they had grandstands, and they had like, I want to say a padded seat, but not really padded, but a molded plastic seat on the.
Okay.
And it was I'm sure it was not just a flat piece of wood. So I'm sure it was very comfortable.
For sure.
But I noticed that there were some things written on the front row, kind of in the corner that, had the universal sign, the wheelchair. And so somehow they must have been able to fold them out of the way or something so somebody could sit there on that first row in the seat. So I never saw how it was done, but nice that it was there. So shout out to them. The other thing I did this weekend, which was fun, have you ever been to Purple Easel?
No.
Heard of Purple Easel?
Nope.
It's a place where you go and they've got an art place there where, there's a bunch of rows of tables and they set you up with an easel and your canvas. And then there's a teacher that comes up and step by step teaches us. So we did it for my friend's birthday. Happy birthday, Darren.
Happy birthday, Darren.
Yeah. So, she got all of her family together and they always include me in those events. So God love them.
Sweet.
Yeah. So I had a good time. We painted a little turtle. So
turtle.
I'll share it
turtle
sometime with you. Right. Okay. Thank you. Thank you for listening to us catch up on our wonderful, exciting lives. And today we've got the infant cochlear implants that we're going to talk about. We're going to meet Dr. Nancy Young and the Tweedies, I think that's their name, Doug and Ewa Tweedy, the parents of a young gal that received these. And I didn't really know that they were so new with infants. That's kind of the point of this whole thing. Because I have some relatives that have a couple of their kids, so kind of like my my granddaughter's kids, that have gotten those and they've worked very well, but they were a bit older, so now it's infants. So we're going to hear all about that right after we come back from this word from our great sponsors, Agyar Professional Training.
At Agyar Professional Training, we know that your greatest asset is your team. Investing in their development, knowledge, and happiness is essential for your business's success and growth. To achieve new heights, it's important to hire intelligent, talented individuals and empower them to excel in their areas of strength and passion. Ugyar is committed to transforming your employees into happier, more productive, and fulfilled individuals. When your team thrives, your business prospers. Wise leaders understand that providing team members with opportunities to shine in their strengths unlocks untapped potential. Elevate your team with Ugyar professional training and witness the growth of your business.
From the Ugyar Professional Training Studios, you're listening to Walk and Roll Live, Disability Stories.
It's a disabled life, rolling alone, leaving my struggles behind, feeling strong. The road ain't easy, but that's just fine, 'cause I'm living my truth, walking my own line. Life is full of joy, I wouldn't change a thing. Overcoming what life hands me, hear me sing. Tough times don't last, but tough people do. It's a disabled life, and I'm breaking through. Every twist and turn, it helps me grow. I rise above the limits the world wants to show. Wheels on the ground, or crutches in hand, I move through the world like a one-person band. Life is full of joy, I wouldn't change a thing. Overcoming what life hands me, hear me sing. Tough times don't last, but tough people do. It's a disabled life, and I'm breaking through.
Yes, we are back on Walk and Roll Live, and we have a subject today that we've wanted to address for a while, but I couldn't figure out how to do a topic about hearing on an audio-only program. So I think this is a good way for us to at least, get some information out there about this disability, and that is a hearing loss. We're talking today about infant cochlear implants, but first of all, today on Walk and Roll Live, we are talking about hearing loss. Today we've got Dr. Nancy Young and the Tweedy family to share their incredible stories. So maybe how did you get involved with this whole field of cochlear implants, Dr. Young?
Well, when I wanted to go into otolaryngology. I knew that in medical school. I thought I was going to be a head and neck cancer surgeon. But when I saw ear surgery, I said, this is what I want to do. And I actually think I'm very interested in language. So between the type of surgery and my interest in language, that's why I became an ear specialist. And then when I started my practice, cochlear implants were very, very new. They were not yet FDA approved for use in children. Mm. So I got to be on the front line, at least from the standpoint of once they were approved.
Yeah. You said that so fluently, which makes sense because you've been in the field forever, but give us the name of the field one more time.
A lot of people just call it ENT.
Yeah.
But the official name is otolaryngology and head and neck surgery.
Okay.
Interesting.
So you founded the cochlear implant program at Lurie Children's Hospital and now serve as president of the American Otological Society. Now, looking back, what has been the most rewarding part of the journey for you personally?
Well, being the founder of the implant program was, that's the most rewarding part of my career. And it's grown to be one of the largest for children in the United States. And more important than the size is, I think, the quality. We really offer multidisciplinary care. We have a lot of different ways of supporting families. And in terms of the Otological Society, that's an honor in a different way. It's been around for over, I think we're in the 159th year, and I'm the fifth woman president.
Amazing.
Congratulations.
I don't know if that's a good or a bad thing, right? It's great. It's great, but it's like, wow, out of 150 years.
Yeah.
Well, and I'll tell you another funny story. When I got in, which is an honor, you have to apply and, be accepted. I never thought this would happen to me. I thought I thought the times back then had changed too much, but I received a tie.
Oh. You're like, okay.
And I framed it next to my certificate.
There you go.
That speaks volumes, doesn't it? Well, hopefully going forward, it'll be a little bit more equitable. Is there a difference, and I imagine there is, between an adult device and a children's device, and what are they?
Well, actually for the cochlear implant, it's a system. There's a surgically implanted device and an external device, and it's actually the same, be it for adults or children.
Okay.
Just the sizing is different.
All right.
And that's the sizing is not different.
Oh, wow.
No, because not at all. It's with growth, and that's a common question that parents have. And it's like, no, with growth, we don't have to replace it because of growth. The inner ear is full size at birth.
Amazing.
Okay.
That's also cool.
It is.
That's cool.
We're learning today. So,
Yes.
so how we also have Doug and Ewa Tweedy here, and they have a daughter that has received one, right? So how do you guys come into the story?
So Ella was diagnosed at birth, as part of both Illinois state law. I believe it's federal law now too, but ultimately you have to go through a newborn hearing screening as part of taking your child home. And so part of that screening is testing for obviously hearing loss. And so for us, we went through that initial screening with Ella, and that's kind of how we got on our initial journey. Was she had failed that exam, and they kind of came back to us and said, this is not unusual, might be fluid, we're going to do a couple more tests to make sure. A few weeks later, we finally get confirmation through an ABR test, which is testing for brain activity when you hear auditory input. And that's kind of when we got our official diagnosis of Ella, which is bilateral profound neural hearing loss.
It's interesting that they call it loss if she never had it. Like, how do you lose something you didn't have? It wasn't factory installed. So
it's a good question.
I didn't get balance, so I didn't lose it. I never had it,
It's more of just a difference in here.
Right, exactly.
We always say it's her superpower,
For sure.
There's an extra superpower there.
She can turn her cochlear implant off and be like, I can't hear you.
And she has.
Yeah,
Selectively,
exactly.
yeah.
That's selective hearing loss for sure, right?
Yeah. I'm just curious about, so much of the learning process, from very early on is tied in with hearing. What is the loss? What would slow it down? And how does it affect it if the earlier intervention with a hearing device is going to keep that on track, right? And I don't know who wants to address that.
Yeah, I think from the parental side of things, right? It is definitely a little, you get a little bit of a worry, right? Am I already behind, right? How am I going to catch up? You see these charts of the difference between hearing loss individuals and kind of, your typical hearing individuals, and being able to see that there is a gap, as you come out of birth. I'm sure Dr. Young can speak more about, the medical process there in terms of both hearing prior to being born, as well as, the importance of hearing early on.
The cochlear implant is the first medical device to actually restore a human sense. So it's really quite miraculous. And it's important to do it early. And that's one thing by being in this clinical trial, that helped the Tweedies to achieve, because we start, as Doug alluded to, we start hearing actually in our mom's tummy, and then we're hearing at birth, and you start to understand things, and then eventually you start to talk. Well, you're behind the 8 ball if you're, not hearing when you're born, but there's an amazing thing called neuroplasticity, and babies have a lot of it. So we want to get the kids diagnosed and get them the effective intervention they need. For some kids, that's a hearing aid. It all depends on how much loss you have. But for other kids, they really need the cochlear implant in order to hear all the soft sounds in speech, particularly, your S, your F, your TH. They're said so softly in speech. We need the kids to hear all of these sounds so that they can learn to understand and to speak themselves.
I just got hearing aids about 6 months ago, and if you ask my daughter, it was probably years and years too late, but I finally got them. But that's the biggest difference right there, is those S's, those sibilant sounds that it just made my comprehension just go through the roof, because instead of it sounding like a Lucy cartoon, I could actually here are those sounds, and it's improved it so much. So where are we in the process? Are we going through the trials? So is it available for infants at this point?
Well, cochlear implants have been around for almost 30 years now. More and more people have heard of them, but in the early days, like when I started, the youngest the FDA approval was for 24 months. And then it went down to 12 months. This clinical trial was for children as young as 7 months of age. And the clinical trial is over, and the FDA reviewed the data and the indications for the MED-EL cochlear implant system, because this was a clinical trial specifically for that cochlear implant system. It is now FDA approved for age 7 months and older. Okay. And they also expanded the audiological criteria. So how much hearing loss did you need to have to be considered a candidate? So the clinical trial was a great success because it showed that lowering the age did not impact safety, and that it was tremendously effective, including for the children who were implanted who had a bit more hearing, that their outcomes were excellent.
That's awesome.
So
giving them a longer runway. I'm curious because we haven't really touched on it. And for people that don't know about cochlear implants, like who invented them? Like how did they come to be? Was it something that somebody was heading to create or stumbled upon it in creating something else? Or we had to get here somehow.
There are a number of key individuals who are, depending on what country you're from, are credited with success. Mm-hmm. So in the U.S., the very early developer of the cochlear implant was William House at the House Ear Institute, and he started with a single channel device, so one electrode. That one electrode device actually never got into commercial use, and other companies developed multiple electrode devices that actually provide more information.
Amazing. It's so fascinating.
Yeah. So what were the concerns, with anybody that objected to it? Or I don't know if there's anybody fighting against it when they do a trial. They just want to make sure. But if it had been approved for adults and then was getting younger at that point, were there concerns or objections?
Well, that's a good question. So the FDA, the primary concern of the FDA is safety. So before a medical device can be widely used, commercially available, you need to prove safety. And then you also have to show that it has some effectiveness. So that's the only reason that they had to do a clinical trial. I mean, the implant system already had FDA approval, but not for such a young age. Now, why is that important? Well, part of it is safety, but actually you raise a good question for another reason. One of the things that insurance companies do and public payers like Medicaid, Medicare, is they'll sometimes say, we're not going to pay for this treatment unless it's FDA approved, and we're going to go by those indications. And if it's an expensive device or an expensive drug, they will often, not let you have it and if you don't meet those exact indications. But all of us have been treated with things that are off label, not FDA approved. And almost any antibiotic you take was approved for a different use. If it's not an expensive antibiotic, nobody cares. They'll just cover it. It creates a situation where, so when a company invests millions of dollars and gets something FDA approved, no matter what it is, time goes on. There's lots of publications showing, hey, it benefits more people. It benefits this and that and the other thing. And the insurance companies could choose to update based on that, but sometimes they're resistant to that. And sometimes it's necessary for another clinical trial. and in order to improve access. So kudos to MED-EL for investing in this clinical trial, which expanded indications, but quite frankly, I already knew from my experience that this was being done safely by myself and others in children as young as 7 months, but there was an access problem.
Right. I mean, especially if it doesn't affect them, we know that insurance companies don't care about access if they don't need it. Like, why? You're a number, you're a name on a paper that they say no, thank you. But if and were your child, then you care. So I want to turn it a little bit back to the Tweedies. And what is it like? Because Doug and I always talk about we are the kids with a difference. So we don't know what it's like to be a parent raising a kid with a difference. So like you get the news that Ella's different, like now what? And you know, especially like hearing, it's obviously you both hear. And so there's a lot of interaction and stuff that happens because you hear. So what was it like for you guys to get that news and, you know, think on your feet?
We found out the same day that she was born. So it was just a big day overall for us. And it was a little bit jarring to hear at first because, you know, normal pregnancy, and, you know, nothing came up on the anatomy scan, which it wouldn't because it is inside. Right. And then, you know, there's a lot to process. And I think Doug had said, you know, they try to ease your worries. You know, lots of times they say, you know, it's just the fluid in the ears. It's probably nothing, you know, let's move on to, you know, are they, having enough to eat, are they having enough wet diapers? Like, let's move on to, you know, all these other things. And I had something, you know, that kind of just hit us at that point that we didn't really know how to navigate, especially as first-time parents.
That's what I was going to say. And also where you're a first-time parent, so you don't have another comparison to be like, okay, this is, you know.
Yeah, Doug likes to say that we jumped right into expert level.
Expert level mode.
I mean, you know,
like the video game. So
the universe does that with people that can handle it. They're like, and here you go.
Yeah.
Exactly.
Yeah. So it was just a balance of trying to navigate the emotions of that diagnosis, but also at the same time, well, you know, these emotions are for a reason. What can we alchemize them into, you know? Yes. And just moving forward together, we leaned on each other, and we kind of just also, you know, in a way took Ella's lead with everything. It was a bunch of small decisions that then led to the big decision of getting her those cochlear implants. So,
how did you hear about that being an opportunity? Who brings it to you? I mean, you're already.
Yeah, that's another thing I wanted to ask too, along those same lines is we talk a lot about community here and finding your community, you know, for your particular disability or just at wide. But did you find your community as well?
Yeah, that's a big reason why we're talking with you today is we're lucky enough we are in Chicago. We're close to Lurie's, have had impeccable doctors like Dr. Young and all the therapists, but it wasn't until we spoke with other parents and other kids that had gone through this. Just leaning on the team, leaning on the doctors, each other, our family, and all the other families that have gone through something similar.
And Lori's has been great about, you know, kind of making space for that community and really creating a way. They have a hearing experience, you know, session that they have. I think it's like quarterly almost. Well, where they kind of bring in both, you know, deaf children, parents of deaf children, deaf representatives in the community, whether it be for education or financial or healthcare, and kind of helping you navigate some of those questions as you go through it. And it's been really helpful for us. You know, it kind of created a platform for us to kind of get help for people who have been in that situation, to been in those shoes. So we definitely feel fortunate that we have that access to that community, because we completely agree. We think that community aspect is a big part of her success.
Yeah. How old is Ella now?
She's 7.
7. Okay. So she's had this for a long time.
She's had this for a long time. She's in a mainline school now, out of Chicago. So yeah, she's doing extremely well. Her reading and listening is top marks in the class. So we're just so happy and proud of her. And she's really taken well to, cochlear implants, to the process. I think the most important, you mentioned community before. I think part of that community is also the parental and healthcare community as well, that you kind of create this bridge by, meeting the obligations on both sides, right? Hey, this is when you come in for the therapy. This is when you're coming in for audiology, and being able to, continuously commit to that is very important to the overall success and that trajectory of success for your children.
Yeah. Yeah. You guys are leading that path at this age, but at some point you have to start to transfer the stewardship of her hearing over to her. And so she learns along the way too.
It's a great point. Advocacy is a big goal for us in terms of both for her within a school environment, education system, but also for her not to feel that, there's a bother here, right? You have a right to learn just like every other kid in that class.
Right.
You deserve to have advocacy for yourself as well.
And she has just so much confidence, which is something that I was worried about. Is she going to fit in? Is it going to be something that kind of impedes her in any way? And she just loves that she has cochlear implants, and, that she's deaf. And, it's almost, I don't want to say a little too much, but we have to temper it sometimes. Because, for example, just recently there was a new student in her class, and, she was saying, I wonder if she's going to have cochlear implants. I think I want to be the only one. It's like, okay,
I want to be the only one.
And we put her in a school where there were other kids that do have cochlear implants, but I don't know if it's her or this generation just embracing who they are, which has been.
I can't get a handle on that either. I was going to school 60, 70 years ago almost. And that's that was my experience. The classmates we'd adapt different sports so I could be included, and now to hear that there's even talk of it, I'm like, we haven't made any progress in 50 years. So I'm glad to hear that. Yeah. That they're just welcoming her in. So Dr. Young, is there efforts to actually get it, I guess, certified to be implanted earlier, or is?
Well, I have to say that I would love to be able to implant children a bit younger, 5 or 6 months. But I think a more important than that is getting more children evaluated who are candidates, evaluated and implanted before a year of age. I mean, despite the fact that there's newborn hearing screening, many children are not diagnosed and treated with an effective intervention during infancy. And it's for many reasons. Sometimes the professionals don't recognize they're a candidate, but sometimes it's this is an invisible diagnosis, and an infant is not expected to be talking. So some people, it's not surprising that some parents just can't believe the diagnosis. There are many, many barriers. And for instance, in this country, the age that children get implants is much older than, in my opinion, it should be. They're often over a year of age, whereas in Australia, they do a wonderful job of getting the children that are born with major hearing loss, getting it all figured out and getting them fitted with the effective intervention and getting them implanted between 6 and 9 months of age. So, it's not just about making a diagnosis and fitting with hearing aids, but it's getting them to the right place where they can get evaluated. It's an art form to evaluate infants, right? In terms of anything, especially hearing. And also getting them therapy. So the Tweedies had wonderful therapists. Finding therapists that are familiar with how do you teach a child to listen. There are not as many of them as there need to be. It's a real issue. Most people are not trained in this in their master's level speech language pathology program. So there's a lot of barriers that parents face. And that's something in my career I've really worked hard in my state to try to help overcome those to the degree I can.
Sounds like it's a good career option for, people in college now, right? There's a lot of need,
but it's not easy to find. Sometimes it's not easy to find the training. But there's work being done to try to expand that.
That's cool.
Ella was diagnosed on day one, so they must have a very robust program there where she was born. Yeah. Well,
she failed newborn hearing screening on day one, but then she had to have, as Doug said, had to have the special hearing test done, which is the ABR. And that's a test that doesn't require a child's cooperation. The baby just lays there asleep, and it's kind of like a mini EEG, and they record the brain waves in response to a repetitive auditory signal. And at that point, the parents knew not only does my child have hearing loss, but a really, really major hearing loss.
Mm-hmm.
And because it was through our center, they were immediately told that, yes, we're going to fit your child with hearing aids, and we're going to recommend you get the therapy, but your child is going to need a cochlear implant, but we need to go through the process of evaluating them for that.
Yeah. So is that pretty universal, the initial screening?
It's now mandated in every state to have newborn hearing screening done.
Okay. And then that leads you, if it's indicated, to go on to something more involved.
Well, so as the Tweedies said, the most common reason that kids don't pass newborn hearing screening is a temporary hearing loss from fluid, right?
Yeah,
when you're in your mommy's tummy, your lungs are full of fluid, your ears are full of fluid, you cry, your lungs fill with air, maybe
everything gets expelled.
Yeah. So 90%, and so a lot of people think, it's just fluid, it'll go away. But it's important to do follow-up, audiological follow-up, to see if, in fact, what's going on. And some kids just get a second screening and they pass, and all is good with the world. Some kids continue to not pass the screening, and they get the ABR, and hopefully that gives the answer.
Mm-hmm. So thanks to therapies, physical and occupational therapies, I am able to live, own my own house and do things and whatever. So I'm curious as to, for the Tweedies, what that therapy looks like versus like what it might have looked like for me, who has physical challenges, but I hear perfectly fine. So.
Yeah, for us, in terms of just our perspective on it, I think first off, as Dr. Young alluded to, the ABR is kind of that final, decision on what is the next step. Then we get kind of immediately thrust into early intervention, right? So we have 3 therapists who come, they do kind of an occupational, an auditory, and a speech. I think at that time she was 2 months old, but speech assessment to basically put her into a category around what kind of services she would require. And so that occurred at her 2-month kind of mark. It was right around her 2-month birthday. So we immediately got her into early intervention, had therapists coming. Most of the therapists that were coming initially were kind of that oral therapists who are really working on teaching how to hear, right? So, how do you do that, right? How do you start introducing those sounds? And, we mentioned before those very like soft S sounds, that's a big part of it, going through, snake and shell, they both have like that S, but slightly different, right?
Yeah, exactly.
And then, that's kind of where, speech banana and all these other kind of forms of evaluation come in around how do I kind of inject auditory information and make sure she's hearing it effectively. So a lot of that is repetition. I know as far as narrating and getting into that narration of every single thing that we do, right? It's kind of unusual at first where, instead of just saying, I'm going to go to the kitchen and get a dish, right? I'm going to go through the kitchen door. I'm going to open the cabinet door. I'm going to take a plate down. I'm going to put the food on the plate, right? You kind of get into this narration so that way they get just the maximum amount of auditory information possible, throughout the day. so they can hear all those little subtlety sounds that you have that you may not even be processing, in the back of your mind, because it's so easy for you to have that conversation. So all that kind of like incidental listening that's happening in that background is just so important for her to just continue to get input and continue to get sound thrown her way. And they start with hearing aids. That's really just part of the process to validate, hearing aids are not giving her enough, auditory information to be able to kind of show that cochlear implants are a better tool for her. And so that's how we got to the point of, it was right around, like, I want to say the 5-month mark or so. That's when Lori and Dr. Young kind of came to us and said, hey, there is this study related to the FDA trying to change the age at which you can be safely implanted with cochlear implants. And, would you be considering of that? Because obviously she's a good candidate, and ultimately we need representatives. So we thought about it. I mean, a lot of the research that we did at that time, we looked at both international, right? What was available internationally. As Dr. Young mentioned, there's a lot of great cases internationally that show that earlier implantation is not only the standard, but results in better results. And so those were kind of, along with like the fact that we looked into Med-El, and obviously Lori's is an excellent track record. Those are the things that really gave us the feeling of this is the right choice for us. And so that's when she got implanted, and then finally turned on a month later. And that was, you always see those YouTube videos online, kid hearing for the first time, I'll never forget it. Ella was, they turn it on, you could see Ella gets really quiet.
Yeah. She's like,
she stops breathing almost, and she's like realizing she can kind of hear a little bit. And then Eva says, is it on? And she turns and looks at Eva. And it's just like, in that moment, it's kind of like, overwhelming. Obviously, there's just so many emotions, but I think it's also important to know that that's kind of like, you're at step one, right? You've gotten the prerequisite ready. Now is the journey of hearing with a cochlear implant, going through the process of therapy, and being as committed as you possibly can in terms of making sure you're making the appointments, making sure you're going to the therapy to ensure that success.
Right.
Dr. Young, I want to turn back to you because a lot of what we've been talking about, I have questions. and one of the things, and Doug was kind of talking about it right there, the hearing is very complex. It's not just, getting those sounds and being able to hear them. We can be in a crowded room, in a restaurant, everybody's talking, but you can focus in on the person across the table from you, and just kind of all that other noise goes away. There may be music playing overhead. You don't hear that, but you can then change your focus to hear that by choice. So does the cochlear implant have those abilities? Does the brain kind of, once it's implanted, start to learn those things with all the input that Doug was talking about?
Yeah. You asked some really great questions. So what you're really getting into is the fact that we really hear with our brain. The input comes in through the ears, but we hear with our brain. And the brain uses input from 2 ears to do a number of things. One of them is to figure out where we are in space.
Mm-hmm.
Yeah.
And connects us to our environment. So it's super helpful. It's a safety issue. And the other thing is hearing in complex listening situations. So all of us, no matter who we are, have more difficulty hearing in the cocktail party situation.
Yeah.
What helps us is 2 ears. So if someone is hearing only in 1 ear, they have more difficulty in that complex listening situation. And in fact, in 2019, the Med-El cochlear implant system became the first to be approved for use in children with what's often called single-sided deafness, to try to give them back that bilateral binaural hearing, right? So when I started doing implants, believe it or not, we were only doing 1 ear.
Yeah, I remember that.
If you go back to the history of hearing aids, which I will tell you, I'm way too young to have been there then, but that's like a whole other generation. But when hearing aids were new, they only gave 1. And in fact, I met a gentleman years ago who told he was an audiologist. And when he started fitting a second hearing aid, people accused him of being unethical, that he must be doing that only for money. Well, implants, because it's a surgery, started out in one ear because we had to make sure, that this work, was it safe? And so I got to see the difference between when we went from implanting one ear to two.
Right.
And Ella was implanted in both ears at the same time.
Amazing.
She's always had the advantage of bilateral hearing. So yes, having the two ears helps her. But quite frankly, the brain is doing amazing things. I've gotten interested in neuroscience research because of what I've been seeing over the years, because what the implant is giving us is it's not the same as normal hearing, yet these kids run with it. It's amazing.
It must also be kind of from the standpoint, like, if you don't have quote unquote normal hearing, you don't know what you're missing, right? Like, so for me, I'm like, I've never walked in high heels. They don't look very comfortable. It's not like some other guests, they were a quote unquote like normal, and then they break their back and they're like, oh my God, what if I never drive again? Or because they knew it. I don't know it. So for me, it's not a loss, right? And if Ella has superhuman ears, then that's what she got, and she's going to run with it.
Mm-hmm. Now, this is something that's introduced into the body that's foreign. Is there any rejection issues?
I've actually done over 2,000 implantations, and I've never seen one that, because it's made of, it's not biological, right?
Yeah.
Right.
I've never seen one that was, in quotes, rejected. Now, that doesn't mean theoretically it couldn't happen. There are people that are rare that react to all sorts of things that are non-reactive. But, occasionally people do develop an infection, and a device may need to be removed. Things can happen, and devices can need to be replaced. But it's just rejection of the materials themselves. That's rare as hen's teeth.
And then, is there a power source, or does a battery need to be changed, or?
It's a system. So the kids wear something on the outside. There are different styles. One looks sort of like a hearing aid, but has a coil that goes back to, it has a transmitter that sends the information through intact skin. So there's nothing sticking out. And there's another style that I call a button processor. It just all sits here on the side of the head. And the external part of the system has the power source, the battery.
Okay.
And most people use rechargeable batteries.
Gotcha.
Yeah.
So for all intents and purposes, what you implant, notwithstanding any issues with it, it'll last their whole life.
I know people, excuse me, people who have had cochlear implants for 30 plus years. Like any sophisticated piece of electronics, it could stop working.
Yeah.
But I've had patients that wish their device would stop working because,
they're tired of the people talking around them.
Let's put it this way. So nowadays there are a lot of upgrades, and you just get the new externals and you get the new features. That's what's been going on for many years. But when I started, there was no Bluetooth, there was no streaming. So patients that got those very early devices, when they became teenagers and young adults, they wanted those features. Mm-hmm. And for that, they had to get a new internal device.
Gotcha.
So nothing that transformative that can't be updated by just getting new external components has happened since then.
Yes.
But you can see as technology advances, who knows what the future will hold.
Right.
So that just, another question popped into my head. So if you have this device, do you use earbuds?
No,
right?
all the device, all the hearing comes through the device itself, and the device has multiple mics on it. And those mics are basically the input into ultimately what's causing the electric, stimulation inside the cochlea, right? So there is no, there is no earbud. There is no, and there's no device that's going inside her ear at all, right?
Yeah,
Everything's being routed out outside.
So, but if she wants to listen to the music on her mobile, then there's Bluetooth connection where you could listen to it that way.
Yep, and luckily, right now it's still mostly plane rides. Throw on a phone or an iPad or something like that, and we always laugh. We always have to like double, triple check because we don't know if it's working or not. Only she does.
Right. She knows.
It's streaming straight to the device and going straight into her brain, right?
That makes my brain hurt.
It's funny. We always laugh that, she has the best possible soundproofing earbuds that can be invented. Is really what it comes down to.
Exactly. That's really cool, though.
One of the things I wanted to address, too, with you guys coming on and just being, we talk about community. There is, I know, a faction of the hearing loss community that is kind of against these devices. And have you run into any pushback from those folks?
We personally have not, but I like to just, there's an organization here in Illinois called Hands and Voices. And their motto, we've gone to their events, is there's different families with different children that have different levels of hearing and other additional needs. And they say, what works for your child is what makes the choice right.
Yeah.
Yeah. And there's always, a certain amount of philosophical differences between, you're getting into kind of capital D, lower D communities there in terms of deaf communities. And I think, Ewa said it really well, right? I think it really comes down to this is a choice that, parents need to make, right? And parents are making choices for their children every single second of every single day. And some choices are more consequential than others. But I think what is important to remember out of all this is that you're giving more choice to a parent. And I think that ultimately is a great thing.
Absolutely.
Yeah,
Absolutely. Sure. And I wonder too, people always seem to resist change and resist new ideas. So now that they've been around a long time, I'm sure that whole argument may have subsided a bit, right? And let's hope so.
I think it's generational for sure. I think that younger generations being more embracing of, you've chosen, one path or another. It doesn't mean that it's right or wrong, right? It's the choice that you're making on a personal level for, your life, right?
Yeah.
Mm-hmm.
I just want to comment that the decision to get in a cochlear, if one chooses to include sign language in communication, that doesn't mean you can't choose to improve your child's hearing. Many of our children who have implants, many of them will, can you use sign? It just depends on how they're doing and what their parental choice was. So, and actually there was NIH-funded research done in the early days of cochlear implant that showed having hearing through an implant for children who were in educational programs where they were both working on listening and spoken language and sign, that the rate of language acquisition doubled.
Yeah, that was going to be my question about so does she also know sign? Because yes, she has implants, but gosh forbid, they fail. Can we help her communicate or,
Well, I mean, it's not likely that both would fail at once. So I think Elle's situation is good. There are children I've implanted many children whose parents are deaf and they use sign language as their primary mode of communication, but they still want their child to have hearing. They want their child's language in sign to improve. They want their child to have the safety of hearing. Many of them also have a goal. Everyone's different what their goal is. Many want spoken language too, because there are advantages to that for employment, for instance, more options. So, every family is unique. And then there are kids that, people come to me and I'll say, what is your goal? And then they'll tell me, and then we'll tell them, well, these are the different choices that you can make. But ultimately, it's parental choice is key.
Yeah. Mm-hmm. Yeah. The more tools you have, I can't imagine somebody, I was a brace and crutch user for a year, polio survivor. and transitioned into a wheelchair over the last 20 years. And I can't imagine anybody saying, you shouldn't be using that wheelchair.
Right. Get out of the chair.
Yeah, it's organic way to get around. Okay, whatever. Great to have the Tweedies here. And I'm just curious, how'd you get roped into this?
We volunteered, really.
Yeah,
I mean,
good.
I'll be honest with you. I think, not only it has been transformative, obviously, for Ella and our family and our goals as a family and everything like that. But, met Ella and Lori's really just made it a phenomenal process as it relates to that. It helped us. It created a structure that I think we needed at the time, right? At the time, it was, you're kind of climbing out, right? You're trying to figure out the shell shock of what has happened, and how do I continue on, and what am I doing next, and what's my next decision. And so it really helped us create kind of that scaffolding for us to be successful on getting her on a trajectory. And so for us, we see it as the morally right thing to do is to give back and make sure that all parents can hear kind of our story, and also make sure that it's okay, like it's going to be okay. And I remember when we were looking back and we were in that situation, we heard this from some of these, videos, whether it be Med-El or Lori's, and, parents saying the same thing, like, it's going to be okay, And so I think at the time we wanted to believe it. And now I think we can, believe it.
You can stand on it. I feel like that is one of the things that my mom does, or family, friends, or whatever. She'll meet somebody who has a child with CP that's still a child, and she'll be like, oh, you can call my daughter because she's an adult and she has a job. And like, I feel like sometimes I'm like, Mom, really? But at the same time, I'm like, I am appreciative of how scared they must be. So to see somebody, to think like, oh, they're never going to get married, they're never going to have a house. No, you can. And you're going to mess up just like every other human trying to figure it out. So
do your best. It just kind of dawned on me. We started the conversation with Addie, talking about that change in somebody's life who may have an accident and has a mobility challenge. Well, your child had the hearing loss, but you're the ones that went through that sudden change of life in that instant and then you wonder what the future is going to be like for Ella. I'm sure that was your first thought, all of the things that you were looking forward to and had dreamt about, for the life of your child. All of a sudden that you get to write a different story. It looks like you guys are doing a great job. Yeah.
And we're doing this for other parents, but also, we're doing this for Ella too.
Yeah.
We want to be those advocates, and that hopefully she knows right now that we're in this interview, and I'm hoping that she just remembers that, and as she grows, she can become her own advocate. And I just can't wait to see what she does.
Yeah. And I think, every kid you have is going to be different than the expectations you have for your kid. Right.
Yeah.
And I think, it took a while to realize that, like to really internalize what that meant, but I think that now looking back, it's like, well, there's probably a million things that we were thinking about that, she hasn't, lived up, quote unquote, to an expectation, but, was she ever going to, right? And like, that's the reality too, is, the embracing of the fact that, this is who you have,
Yeah, for sure. Right. You want her to love pink and be a ballerina. And she's like, no, I like race cars and purple. So,
Exactly.
So yeah, no, I think that's cool. But that is like very much, that is a good set of parents who will let you thrive as who you are, not the box they wanted to put you in. And I think she's lucky to have you guys who are like, okay, here it is. Let's go.
Yeah.
Yeah, Addie would agree. You guys sound like our people.
Yeah,
you're right.
Exactly.
Yeah,
like, yeah, good parents. Yeah,
and then Addie also wanted.
Yeah, she definitely wouldn't have it any other way.
Good. Yeah. Addie also wanted me to ask you: is there, a little brother or sister in the future for Ella?
We actually do have a little boy as well. So
he's good.
And normal hearing, but yes, he is in the picture as well, and she keeps him on his toes as well. So
awesome. We need a little one to heckle. I have a younger sister too, who's like 2.5 years younger than me, and the sacrifice they give up to be a co-pilot, whatever, through life with us is big. And I think the older she gets, the more she'll appreciate that, because I completely appreciate that my sister gave up a lot of childhood to make sure that I had the adulthood I do.
Yeah. Well, all of you, Dr. Young and the Tweedies, thank you very much for coming on and sharing Ella's story with us. We appreciate it here on Walk and Roll Live.
Thank you.
Thank you for having us.
Yes, thank you.
Each week on Walk and Roll Live, we share honest and open stories of people living with a disability.
Yeah, I mentioned earlier that, I was bouncing back and forth between Kaiser and Casa Colina. Obviously, I won't say obviously, but what had happened was I got spun around, and as I mentioned, I broke my back and severed my spinal cord. I didn't know that my legs weren't working, other than the fact that the car next to me that hit me was on fire. I knew that I had 21 gallons of gas in my tank.
Join us weekly for another powerful episode. Walk and Roll Live, wherever you get your podcasts. Life Limitless. Subscribe now.
From the UGYAR Professional Training Studios, you're listening to Walk and Roll Live, Disability Stories.
Walk and Roll Live continues. What'd you think of that conversation?
Well, this is a super cool story. I've always thought cochlear implants were interesting. And obviously I'm a talker. I like to talk. And I realized, or you don't realize when you hear, how much is missed if you don't hear.
Yeah.
And like how much that development happens, and why these are so important, and kind of like helping shepherd people into the life they're going to live in the future. And it's cool that they put in all this time, effort, study, all these things to make this happen so that it can be done at a younger age, so there's less of a gap in when it's searched for people, I guess, right? And also, obviously, I admire these parents for taking a chance on a thing that is new and unique, and deciding that they were going to do that. My own parents did that for a different subject, but I mean, obviously, I like to sit with these parents and chat about that.
Yeah, it is interesting, and because I know I recently got hearing aids. What did I? 6 months ago now, maybe something like that.
I would say, yeah.
And it's been a long time since I know I've had some hearing tests, back when I was a kid or something. But I knew they were going to be testing my hearing by putting something in my ear and having me listen for it. But then they put the device, there's something they kind of put on the bone right here on the back of your skull and test you that way. Yeah. So that way they determine, they can isolate where the problem is. If you can hear it through the bone, but you can't hear it from in the ear, or if you can hear it through your ear, but not through the bone and the vibrations, so that helps with the kind of device you get and all that. Yeah. So pretty sophisticated. And I love them. I love them.
I know. I remember when you first got them and you're like, God, I didn't realize how much I didn't hear.
Yeah. And I know people that are my age, obviously, my peers, a lot of people have, just because of old age, I think it certainly helped, and maybe the wrong words, but it advanced, the loss of my hearing, because I wore headphones for 40 years, and other people listen to loud rock and roll and whatever they did. Some people I know that, are into firearms, so there's lots of ways that it can go, but they're reluctant to wear their hearing aids. I hear people, and the wife will say, I can't get them to wear them, and I'm like, I love them. I mean, geez, I look forward to putting them on every morning because I can suddenly hear and I'm not missing anything. So if you're at that point and you're, an old codger, give in, wear your hearing aids. It'll improve your life.
You'll be amazed at what you learn.
Yeah. Anything exciting this coming week? I guess we got 4th of July coming up this weekend, right?
Yes, we have 4th of July. So I think, I don't want to get myself too excited, because if I'm wrong and I'm not off Friday, that's going to suck.
I was going to ask you. Yeah.
I'm assuming I'm off Friday, because I looked at
They haven't told you yet?
Well, I mean, we get told on the yearly calendar. So I went and looked at the thing that shows you the blanked out days, and Friday is blanked out. I'm assuming.
Okay. Yeah, that sounds pretty strong
I'm
evidence.
I'm going to blank myself out if it's not the case. Right?
Listen, coming up, we've got the Kelly Brush Foundation. I just want to thank Lisa Hilborn from Casa Colina for putting us on to them, and that was a great conversation that we've had, and we're going to share it with you next week right here on Walk and Roll Live. All right? Have a good week.
We'll be here.
Be safe on the 4th of July. Talking to you, Miss Addie, as well as our
listeners. Be safe. I'm probably going to be trying to manage dogs, because fireworks and dogs, not my favorite.
Absolutely. All righty. So long from the Aguiar Professional Training Studio. This has been Walk and Roll Live, Disability Stories, Life Limitless.
Walk and roll life.